The Chinese approach to infectious diseases, from what I understand, is very lacking compared to Western medicine because they rely on this Chinese medicine that talks about elements of the earth and how we're associated with it. And that's early medicine with the acupuncture going back 2,000 years before they understood germs and how germs spread. They created their Chinese medicine theories, which worked pretty good, especially being able to cover all the poor classes with uh, this approach to medicine. They're able to provide even to the poorest people because it's non-invasive, and they can explain it in layman's terms that even the poor, even the least educated in medicine type of person can understand. If you're feeling sick, like you got a cold or something, you got a bad wind, or you have stagnation, we're like little earths on earth, and we all have the same elements of the environment. Like right now it's stormy out. You can have kind of a stormy, cloudy, rainy. You can have the features of excess water, and I feel like I get that too sometimes. I get stagnation from dams in my body not cooking enough. I need to dry the logs out. Need to dry the food out more so I don't have so many watery issues with my health. If things are feeling too watery, then I want to dry things out. And I think cooking, toasting, roasting is a better method. But for infections, the Chinese medicine theories are lacking, and it's like Western medicine can step in and say, "This is my time to shine," because Western medicine is primarily focused on infections, getting the antibiotics out, studying the germs under a microscope, and then identifying them, and then of course getting getting vaccinations ready for that particular germ, because Western medicine understands that as long as the body can identify the germ, they have a better chance of fighting it. And that's not so much the Chinese medicine. And I'm not saying that my Chinese are exclusive to Chinese medicine. They don't shun the Western approach. It's interesting. A lot of them are very accepting of learning the Western theories. It's kind of like chiropractic work too. It's like that's a different mind frame. You got acupuncture. They're different mind frames, and they can work together. But since they're so specialized, it takes a long time just to learn one thing, like acupuncture. I looked at a school for acupuncture. It's like $50,000 for 4 years. They spend a lot of time on learning how to poke somebody with needles. So there, it's a specialty, and they do a pretty good job within their realm. But it's limited. If it doesn't work, you don't just keep sticking with that. You go to another theorist, Western medicine. You go to the chiropractor. You go from one to the next. Sticking with one doctor is what the I don't know why they have that set up like that. That people, traditional nuclear families, need to stick with one doctor. But sometimes the doctors are in total conflict with other theories simply because they don't understand it. And a lot of them don't want to understand it, especially the older doctors. You can't force them to understand the Chinese theories. But I mean, you could have a nerve disorder that could be helped with magnet therapy or acupuncture, and a Western medicine doctor might start saying you have psychological issues because they don't understand it. But if you have a broken bone, Western medicine is on top of that. Chinese medicine can't help that. You got to get that fixed physically, and that's where more hands-on surgical techniques come into play. And yeah, I'm sure Chinese medicine has something for broken bones. I'm not sure exactly what, but they tend to be more non-invasive. And it's, yeah, it's interesting how that works. But for this coronavirus, it'd be interesting to learn how the Chinese have approached it. Have they been trying? Well, they're spraying everywhere and all that. So we know that they're quarantined. They understand that, and people are like, people who have money can't pay for this medical services or something to get tested or treated. But how much are they making use of the acupuncture to at least relieve some symptoms? Because even in acupuncture, they suggest staying warm as a big help in recovery. Warm climates are supposed to help for recovery. These cold, any flu virus does not do so good in the warm weather, from what I understand. But then there's people who say, well, it can survive the warm weather, and of course it has to. How else would it make it to the next winter season? But can it really spread? What does the warm weather do to it that the cold weather doesn't? Yeah, the differences in Chinese medicine and Western medicine approaches might skew how the population is treated.